of start taking the lead in terms of talking about what's happening to us in Africa as relates to climate and health. Recently in Malawi, they had the Africa Regional Climate and Health Summit. I think the WHO was a big part of that. And it's a good thing that we as journalists start thinking of ways to tell our stories in Africa and to be able to like highlight some of the climate linked health emergencies that we are currently experiencing on the continent. And that is why we put together this webinar so that we can start having the conversation ahead of COP28, because there's going to be a health day at COP28 this year. So today we're going to be having two very important speakers speak to us about this topic. But before we start, I definitely want to set some ground rules so we can get the most out of this webinar. First of all, I would appreciate if we can all keep our mics on mute while the presentations are ongoing, so that the presentations, so we can get the best of presentations, we can ask our questions later. But if you wish to speak, it would be best you raise your hand, so that we can call you and so you don't distract the presentations. I would also advise that you write down your questions or drop them in the chat. The speakers will attend to all the questions during the question and answer session. Also, wait to be called upon before you unmute yourself. I'm repeating that because I know sometimes in webinars, it can be we can be tempted to unmute and speak while the speaker is still speaking. We would also take a group picture after the first presentation. So I'm going to kindly ask you to please turn on your cameras at that time so I can see your beautiful faces for the picture. At the end of the webinar, we're definitely going to make the presentations available, so you don't need to ask about that. So thank you so much for making the time. Joining us today for the conversation is Dr. Tolula Oni. Dr. Tolula Oni is a professor of the Global Public Health and Sustainable Urban Development at the University of Cambridge. And she's also the founder of Urban Better, a learning, collaborative, and advocacy platform that, among other things, mobilizes individuals, communities, and organizations for health, sustainable urban environment. We also have Helen Shikanda, who is a health and science reporter for the Nation Media Group in Kenya. But our first presentation will be from Dr. Tolu, who is a professor of global public health and sustainable urban development at the University of Cambridge. So Dr. Tolu, thank you so much for joining us. Please, could you do us the honors?
Thank you, Vivian, and it's a real pleasure to be here. So thank you for the invitation, and it's great to virtually meet you all. I'll just share my screen. Okay, can you see my screen, Vivian?
Yes, I can.
Okay, super. So today I'll be talking to you on the case for placing health at the heart of climate action, and a focus, and why a focus on cities is so critical. So just for context, I come at this actually from a medical background originally. So I'm trained as a physician, and over the years moved from kind of treating individuals to treating cities, because I, got a bit fed up with treating people with the same conditions that then they kind of go back into the same environment and they keep coming back over and over. And I started asking, well, how can we actually stem the tide? How can we go into those environments and health proof them? And I also started noticing that the same environments that had health risks also were experiencing this significant climate vulnerability. And of course, there's an intersection. So this is a rough outline of what I will speak about today. So it's a symphony in 5 parts. I'll start talking about the interlinked health and climate risks, and really showing the case for placing health at the heart of climate action. Why Africa is critical, but I'm preaching to the choir here, but I will just highlight a couple of things from my perspective. Why evidence matters, the case for participatory governance, and why narrative matters. So that's the rough outline I'll take you through today. So when we're talking about the links between health and climate, this is my go-to spider web, because when we talk about health, you realize that actually most of the time what we're talking about is disease, right? And healthcare. So if you look at this diagram, when we talk about health people, you often think about these kinds of diseases, cancer, cardiovascular disease, mental ill health, injury, etc. But that's an absence of health, right? That's not health. When we start to move upstream, what this diagram essentially shows is that the factors that drive and influence these health outcomes, these disease outcomes, are multifold. So often we talk about healthcare access. Now, it's important that I emphasize this: healthcare access is absolutely critical, and we need to be doing much more to ensure equitable and good quality healthcare access, because it's a really important factor that influences your risk of premature death or your risk of ill health. That said, healthcare access is only one of the factors that influence health. And in fact, we know that over 80% of factors that influence health lie outside of healthcare. What are those? They're in the air we breathe. They're in the environments that influence how we move. They're in our access to food. They're in our risk of injury. They're in our connectedness, our ability to connect and build community around us. All these factors play a much, much more critical role in influencing the health of populations than healthcare alone. Now, when you look at the arrows, it's not to follow them. I won't go to them in detail. But the point being, we usually think of, heart attacks. We think about, healthcare. But actually, the factors that influence heart attacks are, air pollution increases your risk of heart attacks, increases your risk of strokes. Your ability to be physically active increases your risk of these things. But we rarely spend time on that, and I'll pick that apart a little bit later. If we go even further upstream and look at the sectors and the environments that influence these, it's the transport infrastructure that we have and its ability to support activities. So how easy or safe is it to walk, cycle as part of your walking, as part of your moving, not just because you have no choice, but by choice. How easy is it to access safe and inclusive public spaces that can support physical activity and support urban infrastructure, urban agriculture, etc. How easy is it to access healthy food? And yes, how responsive your healthcare systems are. So fundamentally, these environments play a really critical role. Now, if you look at the red background, what this essentially shows is that the impact of climate change on influencing all of these, right? So I'll touch on those in a moment, but this is just a one-stop shop to see that these are not things that can be teased apart, but that these factors are inextricably linked. So, for example, your risk of flooding increases your influences the transport infrastructure, if you haven't thought about that. So whether people can walk, or whether once it with increasing flooding, whether things are flooded because we haven't built the transport infrastructure that way, whether extreme heat makes it easy to be outside, the influence of things like a lesser known fact is that air pollution decreases agricultural output and increases the risk of food insecurity. So all of these factors are inextricably linked. So we can see that these factors both directly cause disease, things like air pollution, they indirectly cause disease through reducing your ability to embrace healthy behavior, and they can worsen other diseases. So air pollution is a really good example of that. It causes disease. It can increase your risk of lung disease, or your risk of cancer. It can indirectly increase your disease risk because you can't be physically active outdoors. It can worsen other diseases if you have asthma. Now, this is connecting, breaking them up in a slightly different way and showing the kind of urbanization risks, the kind of climate risks and hazards that ensue, and why these impact on those exposures and outcomes that I showed. So in terms of how we're urbanizing, we have hazards that emerge from the way we're urbanizing and the ways that the population grows. In terms of climate change, you can see the kind of hazards around heat islands, which is where the temperature in parts of the city is significantly higher than in other parts of the city. Flooding, risk of flooding, droughts and wildfires, which is makes the news a lot globally at the moment, greenhouse gases, and combination of these factors, obviously they interact. Combinations of factors against against the background of chronic stressors of things like poverty, living in unhealthy environments, and social exclusion, make it increase the vulnerability to ill health, and that becomes a vicious cycle. So you end up with disrupted or misaligned infrastructure, services, and exposures. We can come back to that if you like, but this is just a good way of thinking about these different factors. Now, I'm putting all of these things together, and you can see that they can result in a vicious cycle of accelerated emergencies and vulnerabilities. But yes, a vicious cycle, but there's an opportunity for a virtuous cycle here, right? And by that, I mean there's an opportunity for thinking differently about how we act, from thinking about action in silos to think about, how do we improve health? Or how do we make better cities? Or how do we improve climate resilience? To say, are there any actions that we can take that can do all those three? Wouldn't that be awesome, right? Wouldn't that be incredible to have triple duty actions that say improve health, make for better cities, and improve climate resilience? So this is the sweet spot of the work that I do. And in fact, we know that is that in the next slide? Okay. Now we know, in fact, that the evidence shows that the key pathways that we know that you can improve health through climate mitigation are through addressing air pollution, are through supporting physical activity, so supporting people to be mobile. So that's a lot of the transport infrastructure, but also public space infrastructure. And it's around food. So ensuring that we have food environments that are both climate resilient, so looking at agriculture, looking at land use, and reducing that risk of flooding, reducing the risk of food insecurity, but also making sure in the ways that these are planned, people have access to healthy, nutritious food. So addressing those three, any of those three does this triple DT action, because it makes for better cities, it addresses, tackles climate change, but also helps to support healthy behaviors and health outcomes. So we know what to do. Why is Africa critical? This map shows the pace of growth of cities worldwide. It is the number of people moving into cities per hour. So the big cities, global cities that often reel off people's tongues, London, Paris, New York, etc. This is their pace of growth, of urban growth. Compare that to Lagos, 56 people moving there, Cairo, 42, Kinshasa, 47. So Africa and Asia are by far the fastest urbanizing region. So these cities are the cities that will make or break climate action, because we know that over 50% of greenhouse gas emissions are coming from cities, right? So we know that actually has to be a really critical part of the action that's taken. Now, in Africa, it's actually the fastest urbanizing region. And by 2050, we will have over 50% of global and urban population growth. Isn't that just incredible, right? So that's one thing to bear in mind. So we need that urban lens when we're thinking about tackling climate action. We necessarily have to have an urban lens on the African continent, because this is where the emissions will be coming from. And this is where the people will be, and already increasingly are. The second reason Africa is so important is the age. So if I was going to ask you, just type in the chat what you think the median age in Africa is. Let's hear some examples in the chat. The median is similar to the average at the moment. Any guesses? Okay, we have some enlightened we have some enlightened journalists in the room. Exactly. The median age in across the continent is 19, right? So that ranges from some countries have a median age of 17, even under 17. If you take somewhere like Lagos, it's something like over 3/4 of people are under 30. Over 3/4. I mean, let's hear it for a moment, okay? So when we're talking about health, why, given that we have that younger population, why do we just go to healthcare when we talk about health? When the vast majority of our population is young, why are we not saying, we have limited resources. Thank God we have a young population. How can we keep them as healthy as possible for as long as possible, so they don't need healthcare too soon? Because we can't afford, we're slowly scaling up. We have to address healthcare, but we want to make sure that they don't need healthcare too early. Can you imagine what that would look like? Why do we have the same definition of health as the Europe, a continent who, do you know what the median age in Europe is? Any guesses? It's 42. It's 3 times. So when you have a population where so people are so much older, it does make sense to think about healthcare as a primary, because we all get sicker and as we get older, right? But in a young continent, why are we not saying, okay, health for us is slightly different, right? Okay, under fives, there's some very basic access to healthcare that we need to make sure, preventable diseases, vaccinations, basic. But the rest of them, do you know the rates of heart attacks, the rates of strokes are going up on this continent at increasingly younger ages? We're squandering our dividend. So this is the reason why this continent will be important. And not just what is important, and not just from this kind of critical population perspective, but because we just have this huge plethora of change agents, right? That is the dream of other places, right? So a combination of, we have these cities that are kind of going, just coming up now. Just for context, over 2/3 of the investment in urban infrastructure on the continent is yet to be spent. So we're just building our cities now. We have a young population. Can we imagine differently? Can we think about reimagining cities as spaces and places that support climate resilience and health? Not thinking about how we fix all the time, because we're building now. And we're making the same mistakes now, and then we talk about fixing. So this is just the really exciting thing for me, right? It's just yeah. Anyway, you get my point. What are we doing at the moment? What we're seeing is the ways that urbanization is happening is disrupting ecology. So we're not thinking about the balances between human and natural settlements, and that increases the risk of emerging new diseases. We're urbanizing in ways that facilitate transmission of existing diseases through the kind of the ways the cities are growing. We're increasing vulnerability to disease by exposing people, and as I just mentioned, increasingly young people to these unhealthy environments. And we also have inequitable access to care. So there's this dimensions of inequality around exposure, around susceptibility, around access to care, around consequence, that we have to bear in mind and we have to address. Now, we have Africa Union's Agenda 2063, which does include goals of health and well-being and includes goals of inclusive sustainable cities. But how we do that is currently unclear. And when we talk about climate change and we talk about health, these things are often siloed. So we talk about health and we talk about, okay, what is the healthcare sector doing? And we talk about climate and we talk about the Green Fund. But what is the Urban Fund doing? Most of the time, a lot of the time, the Urban Fund is driving the disease, right? So you're pushing people into ill health, and then you're saying, oh, look, we're developing new cities. Isn't that nice? But we're making people sicker, but we don't see that in the urban fund because the healthcare sector sees that. So we just really need to bring all these things together and make sure how we're thinking and how we're imagining is aligned. So what if instead we could imagine a world where access to health enabling climate resilient environments in cities was a central guiding principle of all urban development? Does anyone live in a city where that you feel that is the case at the moment? Oh, somebody is presenting. Somebody is hijacking me. Can you see my screen?
Sorry, I'm trying to remove that person. Just give me a minute. I'm sorry, Dr. Tolu. Please continue.
Okay, all right. So this is the vision, right? So if you're seeing any kind of new growth, new development, new growth, asking, yes, but are they thinking about health? Is the environment's been health enabling and climate resilience? Because as I mentioned before, we know the pathway to doing that is looking at the sectors that address that influence air pollution, the sectors that influence the built environment and how people move. So that's like green infrastructure, that's the blue infrastructure, that's grey infrastructure, kind of walkability, the sectors that influence how food is accessed and produced. So if those sectors, and none of those are the healthcare sector. So if those sectors are not prioritizing health and climate resilience, what we're doing is setting and laying down infrastructure that is driving ill health, and that is that we're going to have to fix in a few decades, which is a missed opportunity given that we're building now. So if you remember nothing from this talk, please remember the need to reframe the narrative on how we talk about integrated health and climate action in Africa. One, that health is not a synonym for healthcare. If someone says blah, blah, and health, ask them, are you talking about health or are you talking about healthcare? Healthcare is a part of health, but it's not all of health, right? So on that note, I do want to mention that it is important to think about, there's an aspect of thinking about climate resilience in healthcare systems. So healthcare systems contribute to greenhouse gas emissions in terms of how they manage waste, in terms of how they sterilize equipment, how they manage heat, etc. So that is a critical part of healthy climate resilience. That is not the focus of my talk, but I just want to make sure that I kind of give you a complete picture. But I'm more focused on urban systems for health and climate resilience. So one, that's an important narrative on health to reframe. Two, please reframe the narrative of youth as a it's fine, I can take over when that person tries. Reframe the narrative of youth as a niche group. There is just this habit of talking about, oh yeah, let's ask the youth what they think. Okay, on a continent when 3/4 of people are youth, if you're not talking to youth, who are you talking to? Right? So can we reframe youth not as a niche group, like let's speak to people and then let's speak to youth, but as the majority demographic that needs to be at the heart of any imagining, of any action, or of any kind of advocacy, of any, like, because it's most people. So please, I would urge you to push and be part of reframing that narrative for the continent. And the third is reframing the narrative around public space, because I see public space as health infrastructure and climate infrastructure. So say, for example, roads. Roads are public space. We just decide to use them for cars. That's just a choice, yeah? It's public space. So if we think about public space as health infrastructure and climate infrastructure, and think about this all together, then we're starting to think very differently about how to shape and how to create cities that are actually support health and climate resilience. Okay. All right. So the third, so we've talked about integrated health and climate risks. We've talked about why Africa matters. This is the case for evidence and why evidence matters. So, you know, I've focused, as I mentioned, on those pathways to create health through climate mitigation action, air pollution, food environment, and built environment. And I'm going to talk a little bit around this intersection of the built environment and food environment to illustrate my point. This is just picking up on the previous point around public space and a reformatted spider diagram to show the importance of the built environment, but also the critical need to move beyond individual awareness. Often when things are complex, we devolve to the oversimplifying to, okay, let's just raise awareness. Awareness is really critical, but you cannot ask people to make irrational decisions, right? If I'm aware that I need to walk more and drive less, but if it's not rational for me to do that because of how the city has been designed, awareness will only get you so far. Yeah, we need to be pushing for how do we make environments supportive to make the easy choice, the healthy choice, the easy choice, the climate resilient choice, the easy choice, right? This is where we need to be moving to beyond, kind of going upstream as well. I mentioned about Africa's young population and opportunity to preserve health, but at the moment, we're not necessarily taking about opportunities. So say, for example, we have over 20,000 deaths per year attributed to insufficient physical activity, and we have almost 1 in 5 people being physically inactive. Now, yes, this is the case, and we need to embrace that more, healthier behaviors, more supportive environments, but it's also important to learn to take an asset-based approach and to learn that, yes, people need to be healthier, we need more supportive environments, but some people are already doing that. Some people are already claiming these public spaces for physical activity in ways that are not, even in the face of climate vulnerability, even in the face of unhealthy environments. So we conducted some research in Lagos and Yaoundé a couple of years ago to say, let's find those people and let's ask them, which kind of spaces are you using? What are the health risks that you face? What are the climate risks you face? And actually learn from them. So let's not pretend as if nobody knows and we're the ones that know we're gonna come. Let's learn from people already using these spaces to say, okay, these people are kind of champions and they're doing what seems kind of crazy, but how can we learn from them to shape the cities in ways that make it easier for other people to embrace this kind of behaviors? What did we find? We found that people, I mean, this will not be unfamiliar to you. The kinds of spaces that people use, spaces on the bridges, the car parks, in the middle of the roundabouts, on busy roads. So you can imagine, remember one of the pathways to health and integrated health and climate risks, access to exposure to air pollution. Think about, well, okay, you're doing a healthy behavior, but you're actually increasing your risk of other health risks. Because you are in a context that has these emissions, right? And there's an equity issue here because we found that people were more likely to undertake activities in these kinds of spaces in lower income neighborhoods. By the way, I wouldn't show it here, but when the pandemic hit in Lagos and there was a lockdowns, right? There were the people that took to the streets and then were using the spaces that were the public spaces for physical activity, because suddenly public spaces were for people because there were no cars there, right? Okay, I'm a public health physician, so I'm a bit conflicted because they were kind of breaking lockdown rules, and you know, that was whatever. But the point is that often for me, what it unearthed was unmet demand, right? People want healthy, climate resilient public spaces. And when you have a moment where the air is clean, where the risk of injury is low, people claim those spaces. And that should be a lesson. Air pollution is the second largest cause of disease and premature mortality in Africa. Let that hit home. What kinds of diseases? Respiratory infections. So in Lagos, over 50% of deaths that were due to air pollution were in under fives, children under 5. Seriously? Are we okay with this? There is nothing unavoidable about this. And if we're not addressing that source of ill health, which by the way would also be addressing climate action, we will never catch up with more and more healthcare because we're just making the children sicker. Okay. I've talked about this, so I'll skip. And despite being the youngest continent, 16% of global deaths from air pollution are on the continent. Now, the graph to the right is a lesson, because I'm focused on ambient to outdoor air pollution. Indoor air pollution also critical, but I show this to show that change is possible. Indoor air pollution has been going down. It still has a long way to go, but it has been going down. Not just by itself, because there's been concerted action looking at clean cooking, and it's just driven the exposure to air pollution down, indoor air pollution down. So change is possible. Sometimes these things seem intractable, but change is possible, and not in that long space of time either. This is the cost of air pollution. So I'm zeroing in on air pollution at the moment because it's a perfect nexus of health and climate action. This is a report from the Clean Air Fund that shows that across Accra, Cairo, Joburg, and Lagos, the cost of air pollution over between now and 2040, so over the next 17 years, is estimated to be over 100 billion. And look to the right, the cases of Accra and Lagos. You're having more premature deaths from air pollution than you are from malaria, from tuberculosis, from HIV. These are avoidable deaths, and these are deaths by the ways that we design our cities at the moment. And despite this, we still have only 6%, it's changing slightly, but this is from a few years ago, of children on the continent living within 50 kilometers of an air monitoring station. The equivalent number in Europe is over 70%. How can we change what we're not measuring? We need to do better at measurement. And the previous study that I was sharing shared with you around the looking at how people are using public space for physical activity. We measured air pollution in one place, just one place in Lagos and one place in Yaoundé, and these places were close to where people are physically active. And what I just want to illustrate with this is why data is so important. What we found in both cities is the impact of harmattan. Now, harmattan is a natural phenomenon, so it's not man-made. So we see, from the dust in the Sahara, etc. But we see a huge increase in the air pollution exposure during harmattan in these public spaces. So now you can imagine, if we know this, we can then say, okay, let's tailor our messaging so that if you are at risk, right, if you have asthma, okay, during harmattan, maybe exercise indoors or exercise after it rains. If you measure air quality in Lagos after the rain, the air quality is so good. So these are the kind of things that if we know, right, we can then tailor messaging, public health messaging accordingly. But we have to know what the data is showing. This is another, I won't go into it, but it just shows even the time of day matters. Not just the time of month, but the time of day when you're and air pollution matters in both cities. So the point is that health doesn't trickle down from good intentions. We have to measure. We have to measure the health outcomes. We have to measure the exposures that are this intersection of health and climate action. And let me just give you two illustrations of why this is so important. This is from the US. they found that because it was a natural experiment that looked at the impact of the lockdowns, right? So obviously different states had different levels of lockdowns, and they found that the states that had the strictest lockdowns, so had because there were no cars, much fewer cars on the road, where the air pollution decreased significantly over a 4-month period compared to the previous year, had a significantly fewer heart attacks in 4 months. And more recently, again, this is an example from the US. There was a closure of, I don't know if you saw this, I'm consciously using you can find the academic paper from that media report, because I just want to show the power that journalists have to capture these narratives, that found that a closure of the coal plant resulted in an immediate decrease in emergency room visits for heart problems. And that continued to decrease over 3 years. The case for participatory governance. So when you talk about governance and decision making for these healthy climate resilient cities, I think about 3 A's: actors, agency, and accountability. And this is important because I find that, when you're in places where, if you're a place where there's no money, it's like, oh, we can't do this because there's no money. Then you have money and like, oh, we can't do this because we're not measuring. We need the equipment to measure. And then you get the equipment to measure, and then you realize nothing's happening because nobody is seeing the data. So no one's doing anything about it. So it kind of starts to trickle down, and you realize that it's not just funding, it's not just equipment. You have to have transparent governance, and that requires key actors to be involved. And that's just not top down, but bottom up. Different classes and people like journalists have to be involved. The majority demographic have to be involved. Government, the private sector, like whoever's playing a role has to be engaged in this. Agency, do they have the agency to drive demand, to drive and to do the work that they want to do? So you have people in government. Do they have the agency and alignment of incentives to ensure that the decisions they're making are climate resilient and healthy? And how can that be better done? And lastly, accountability. How do we better connect the source of the problem to the issue, right? How do you ensure that if you're building this development here, that is actually increasing the risk of emergency admissions, that we connect those data? Because if you don't see it, you don't have accountability. How do you get data in the hands of people to make sure that those actors are able to have the agency to drive accountability? How do you ensure that people have the skills to tell their stories and to have this integrated action and advocacy? So think about those 3 A's. This is a quick example I'll run you through, and then I'll close off. Urban Better, we ran, we have our flagship kind of advocacy is Citizens, and we had the Citizens for Clean Air initiative last year, which is we talk about precision activism, so working with the majority demographic to generate data to inform advocacy and action. So this was run in Lagos, Cape Town, and Accra last year. We were testing out, we recruited the people from the majority demographic. We equipped them with wearable air quality sensors and an app where they could capture sources of air pollution and other health and climate risks. They integrated those data and then they used the findings to, where is it going? Okay. They collected data in this way so that you could see, okay, different parts of the city within cities have different air qualities, and they use that information to design advocacy campaigns based on the data that they generated. So this is an example of the Citizens in Lagos. One person from each city represented the citizens at COP27, where they had an exhibition. We actually had a run. I should mention that we use physical activity as a means to capture that information because it's a reminder of that integration and the need to have healthy and climate resilient cities. So they capture this information whilst they're running. We had a run in Egypt as well, where they captured information. This was citizens from Lagos showing some of the Lagos government, some of their findings, and they talked about it. So you can start to see when you put this data in the hands of the majority demographic and you use that to tailor messaging, you get much more contextually relevant data, and it pushes for this more integrated and participatory governance. They had a social media activation around on the Youth and Science Day in COP27. At its peak, we kind of reached up to, over the kind of month before, to almost 2 million people. So you can kind of sense of really the power of these citizens, and really what we had identified was this unearthed untapped potential to engage that majority, to help understand how these health and climate risks are evolving, and to drive demand and action. And actually, we are scaling this initiative, starting in Lagos and Accra. So if you're in either of those cities, definitely get in touch, because there will be more stories to tell in the years to come. And the idea is to move from being a project to building the infrastructure that allows people locally in perpetuity to continue to capture this information, working hand in hand with government, with civil society, to drive demand and action for healthy climate resilient cities. So this gives you a sense. This is one of the citizens in Lagos. The story was run by The Guardian in the UK, because after this he ran the Lagos Marathon and captured the equality during the Lagos Marathon when the roads were closed, and he ran the whole marathon again when the roads were not closed, to look at the comparison. So you can follow him on his Twitter to find out what he found in those spaces. It was also covered by Al Jazeera and Femi Oke in Al Jazeera. So you start to see the power of journalists like yourself, right? To capture that narrative and to frame, to say, you know what, yes, these are the issues and this is how we want to think about it, but also these are the people doing something about it. Lastly, why narrative matters, right? Because this is not my topic area, I will just speak a little bit more philosophically. That when we talk about addressing complex issues, there's often this paralysis, right? Where do we even start? Like, my spider diagram, like everything is involved in everything. Like, where do we start? There are three key enablers that this is from philosophy of action in the face of complex issues. One, the situation has to be perceived as negative or out of the ordinary. Without that, it's just like, the air quality in Lagos is always like this. That's just how it is. No, it's not. It's negative. It is not normal. That's the first ingredient, right? And that's why I have to push that. Secondly, there has to be a link between the cause and effect, right? The challenge with that is, things like air pollution, things like some of the other climate hazards, the risk to health outcomes sometimes is delayed, right? It is not like COVID or infectious disease where you're exposed to it and then 5 days later you get sick. Yeah, but there is a lot we can do with data to bring these data together to better show that link between cause and effect, because that is a critical part of pushing action on such a complex issue, and that requires different sectors telling stories across sectors. And the last enabler is it's clear how you or someone else plays a role. So what is your role in this action? And this is why these sort of communities are so critical, because identifying what power you have and what you can do to effect this change is critical. So think about that over time. I'll leave you with this, because this is the urban better model of how we think about change. We think about aspiring, inspiring, and conspiring as three critical ingredients. Aspiring, in as much as we can't change what we don't measure, we can't change what we can't imagine. Yeah? If you can't imagine a different Accra, if you can't imagine a different Nairobi, you can't change it. You can't change the current situation. So how do we build this world? How do we shape new norms? How are we equipped to imagine and aspire that it can be different? Inspire, and this is democratizing data, getting people involved in capturing information, making sure information is in the hands of people, to tailor advocacy, to inform decision making, to push those boundaries of who is engaged. And conspire, the importance of community. And this is why I'm so excited that this community exists, because you are the people that will ensure that you tell the stories that ensure that we accelerate action, and you have a critical role to play, right? Increasing that demand for healthy climate resilient spaces, advocating for the relevant actors to increase the supply of health and climate resilience from place. So thank you for your commitment to this cause, and I do look forward to aspiring, inspiring, and conspiring with you. Thanks.
Thank you so much, Dr. Tolu. Please let's say thank you to Dr. Tolu in the comment section. That was such a robust presentation. And yeah, there's so much that I've learned myself, because a lot of things in terms of maybe the data you shared, and seeing that Africa's population is increasing, our industrialization is going to increase in the coming years, emissions are going to increase, so it's interconnected. And like you said, the roads themselves are even healthcare infrastructure, because people who use these roads have to be healthy as well. So thank you so much for that presentation. I'm sure that we're going to have a lot of questions, so I'm going to advise everyone to put their questions in the chat, because after the second presentation we will take all the questions at once. But right now, I would like for us to put on our camera so we can take a group presentation. I see some hands up. We're definitely going to attend to everybody, because this is our community hangout. It's for us. It's with us, for us. There's this term they say, it's for us and it's with us. So we are involved in this. It's journalists, it's our community. So we're going to keep talking about these issues and try to improve our reporting on climate change on the continent. So thank you very much. Let's have a group picture. Okay, I see our beautiful faces. Let me try and get the grid. Our cameras are coming on. Okay. Ruth, your camera is not on. Okay. So smile, everybody. Let me do that again. Okay. All righty. Thank you very much. Thank you so much, everyone. Yes, so sorry. Okay. So we're going to go straight to the second presentation, but I'd appreciate if we just start dropping our questions in the chat, so it will be easy to go through everything at once. Helen, are you ready?
Yes, I'm ready, Vivian.
Okay, so I'm going to share your screen. Okay, so can everyone see my screen?
Yes, very well.
Okay. Okay, so yeah, so our second presentation is from Helen Shikanda. Helen is a health and science reporter for the Nation Media Group. She has been a reporter for 4 years now and is specializing in producing multimedia content in health and science for the Nation Media Group. In her 4 years of practice, Ms. Shikanda has been a part of a number of fellowships and trainings, such as the Bettina Fund Mentorship Program by the Thompson Foundation, the Oxford Climate Journalism Network, the Africa Resilience Network, the Africa Academy of Open Source Investigations by Code for Africa. And she was also a Climate Tracker Climate Justice Fellow at COP27. So thank you so much, Helen, for joining us. We are ready for your presentation, so I'm just going to make this full screen. Let me mute myself so I don't distract everybody.
Okay, thank you, Vivian, for inviting me. Sorry, guys, allow me to have my video off because of the internet at a place that I'm at. But thank you, Vivian, for inviting me to discuss this important issue about climate change and health. Just to give a little background of what I have done in the past 4 years. So I started out as a health reporter when COVID-19 started. And in that 1 year, I did not do any climate stories. So basically, I was just doing
Helen, are you there? Is it just me or Helen's network is having issues? Helen? Okay. Hi, Helen. We can't hear you. Okay. I think she has network issues. So, no. Helen, can you hear us? Yes, I can hear you. Yes, I can.
Hi,
You
Vivian.
were, you were up.
Can you hear me?
Yeah, it's
Okay.
fine.
Sorry about that. My internet has issues. I'm sorry about that. I hope it will be smooth in the next slides.
Okay.
We can move to the second slide, please. So when Vivian asked me to do this presentation, I just thought of how can I sort of explain that linkage between climate and the leaves being health, because one has to take root for the other to grow. So if a climate crisis happens, then definitely there's going to be a health crisis. So just think about, Vivian, can move to the next slide. Think about any of the climate issues in your countries and some of the health issues that come about from that. As you think about it, you can type in the chat so that we can know people are from which countries and the climate issues in their countries. I'm sorry about that, but I was saying that if you can type where my anyone can volunteer to speak or type in the chat. I see someone from Uganda says they have floods, some have landslides. Anyone from Nigeria, Kenya, South Africa? Okay, we can move on. So some of the, I'll give examples in my country, which is Kenya. We have floods in some parts of the country. We have drought. They affected people in any way? If you have floods in your country, have people been displaced to other places? Are there any waterborne diseases that have come about because of floods? In the drought-stricken areas, do people get enough food? Do they get enough water? So that is how you sort of analyze how they have affected people. And when you analyze how the climate issues have affected people, you will most likely get the human impact of climate change on their health. Sometimes it could be direct, sometimes it could be indirect. And I'll give an example. I'll give an example as we go in the next slide of some of the indirect ways our health can come out because of the climate crisis. Vivian, the slide, there's another slide before this one. Okay, yeah, that is it. That's the slide that I'm talking about. So once you get health, how do you execute it? How do you give prominence to health? Because we know that we can tell the climate story, but how do we give prominence to the health story? So as my editor always says, I see people are still typing the climate issues about floods here. But I was saying, as my editor always says, that if your story doesn't have a human face, then people will not relate to it, because people relate to people's stories. So once you get the human face in your story, then it's going to be easier for you to explain why this is linked to climate change. So something else I'd say is, unless that my network today is letting us down. I'm sorry guys about that. So let me just be quick. So I was talking about giving the human face to the climate and health story. Vivian, we can move to the next slide, please. So what do you do after finding the human face to your climate story? Of course, if you're a science writer, you know that there are scientific reports, there are climate experts, there are policies. So let's say there's floods in your region from Nigeria, and then some people have policies in your country that are talking about cushioning people who have been affected by floods to be taken away, like early warning systems. So you can include those gaps. And if there's no policy related to that, it's your story that can inform that policy. And basically that is what journalism is about: informing policies, changing and educating people. Can you hear me, guys?
Helen, we can hear you now. We lost you for a bit. Yes.
Okay,
I can hear
sorry.
you.
I think you keep. Okay, please move to the next slide. I had already discussed about this one.
All right. Okay. I'm using a different window. That's why I keep coming back. Okay.
Okay, no worries. The next one after this one, because I talked about this already. Yeah, so this is after you've Yes, this is after now you've published your story. Do you just let it sit on your website or wherever you'll be publishing? If you're a TV story, after it has run on air, do you just let it be that way? You have to talk about it everywhere on social media, get back to your experts so that they can appreciate that at least they didn't waste time speaking to you. And
Helen? Helen, can you hear me?
Vivian, can you hear me? The next slide, please.
We can hear you now. We lost you again. Okay. Can you see? Helen, can you hear me? Oh no. Hi, Helen. Oh no. Okay, so I think Helen's network is having issues. So I think we're just gonna Helen, can you hear us?
Yes, I can hear you.
Oh,
My network
please.
has issues, so I think we'll just go straight to the stories that we can do in line with climate and health.
Okay. Okay, please. Let's do that. Okay. This one?
Vivian, could the problem be sharing of the screen maybe?
Can you hear me actually?
Yeah, I can't see anything on your side, but I can still speak about the stories that I've done in relation to climate and
Can
health.
you see my can you see my can you see my screen?
Yes, I can see your screen.
Can I Okay, so let's just go ahead with the story example. Can you see it now?
Okay, so some of the story examples, yes, I can see it. Most of the stories will be stories that I have done in regards to climate and health. And one of those was the one that is on the top left. The story, it was a collaborative story where we talked about how the warming planet is making people sick. Basically, we just analyzed some of the most prominent health issues affected by climate. You can think about cholera cases rising, the vector-borne diseases moving to areas that were not there previously. Like recently in Kenya, there was a conference by the Kenya Medical Research Institute in the coastal region where that's the inland areas, and it wasn't there before. Those are some of the ways that we can tell the climate stories. And then there's this story by the Associated Press that I liked. It's talking about how doctors have also seen the evolving way of how they're treating people and how climate change has a part in it. Vivian, please move to this next slide.
Can you see?
So from the story that we did previously, just an analysis of climate and health issues globally, one of the issues was mental Yes, I can see the screen, but I can still talk about it. One of the issues of how climate change is affecting health. So this study was done, this story was done by the Washington Post, and it basically talks about eco-anxiety. I don't know if you heard of that term called eco-anxiety, where people are affected by, people's mental health are affected by the climate changes in their areas. In Europe, if you talk of heat waves, how is it affecting people? In Africa, if we talk of floods, people moving from their homes where their culture is to different places, how is it affecting them? Those are some of the mental health issues. And I remember last year I did a story on people who are displaced by floods. And one of the women whom I interviewed told me about her grandmother who literally refused to get out of their home because she didn't want to leave the husband's grave there. So she had to stay there. And unfortunately, the grandmother died because she could not move to a place that's a bit safe. So the water levels in their house risen to a level that she could not even move out, or no one could get to them. We can move to the next slide, please. Vivian? Yes. The other story that I did actually as recent as Tuesday, it was published on Tuesday this week. And I believe Dr. Tolu has been talking about air pollution a lot, has been talking about the science. So for non-Kenyans, I'll just give a background to this story that I did that was published on Tuesday recently. So our government has be tear gas, there will be burning of tires and such things. So what I did is I reached out like Kisumu, and I reached out to people from Call for Africa Airco, which is based in Kampala, Uganda. People from Kampala, I see someone from Kampala I was here. So they have data on air quality on different days. So I was just curious to see what the air quality was like. Recommended guidelines of 15 micrograms per cubic meter in a day during the protest days. And if you check where there was no protests and areas where there was no traffic at all, using the data that was shared to me by people from Code for Africa, I noticed that the air quality was quite good in areas that there was no protests and there was no traffic on those days because most people are not going to work. So to put the human piece to the data that was shared to me, I went to interview people who were right in the middle of the chaos, that is, people whose areas were affected by the protests. So I went to some of the slum areas in Nairobi, Kenya, like Mathare, and I interviewed people who have existing respiratory illnesses. And one of those who had asthma was telling me how she was just walking or sitting in her house, and then there was burning of tires outside, and suddenly she fainted and was about this because I interviewed another grandmother also who she was just in her house rather, and a police officer stormed in and fired the tear gas canister, and she had her grandson, and it affected both of them. They had to be rushed to hospital. So when I talked to the people instantly, unless they have existing chronic illnesses, other diseases that Dr. Tolu talked about. It could be cancer, it could be lung diseases, any of those.
Helen?
So when we talk about these stories, we have to contextualize with the data that we have, because we can't report things without facts. We have to speak to the human face so that people can relate and say, oh, me too. When the protests were happening, I was affected by this. I had to be rushed to hospital and such things. And also it may inform policies, because when the government sees this, they'll try to tone down and sort of deal with the issues that are posing. But the burning of tires and the use of tear gas. And after this story ran, the health ministry actually reacted to it, and they were talking about it on Monday. The health ministry of Kenya, they were talking about clean air policies on motorists.
Helen,
The other story idea that maybe that
Yeah.
is linked to climate and health, this is
Can you hear
and
me?
how she just spoke to experts to
Yeah,
see
you're
cases.
breaking up part and we're finding it hard to follow. So okay. I think it got better.
Where did you lose
It's
me?
just been breaking up a lot. So let's just move ahead.
Okay, so my colleague linked the cholera crisis to climate change, and she didn't just link it because she knows what is happening. She had to speak to experts. She had to go to the ground and see what is happening to the people who have been affected by cholera. And that is one of the ways you can also tell the climate and health story.
Helen, can you hear me? Okay, I've moved to the next
Can
slide.
hear you? Yes. So okay, so the other story that I did, which I talked about earlier, the indirect impact of climate and health. This is a story that I did last year on how climate wars come about because of climate change. And when I was making this presentation, I just thought that there could be a link, a health link to it, because this young boy that you see on the picture was shot at, and they had to take him to hospital. That is an expense that they didn't expect. And the bone of contention was that there were two communities that were depending on one water source. And when this boy took their kettle to that river to get water, he was shot at. And when he was shot at, of course, he had to go to hospital. The last example is by Vivian Chime here from The Cable, where it's almost the same as the story that we have shared of my colleague on how climate change influences cholera cases. And as some of you may know, last year Nigeria had the worst flooding experience ever in 10 years. The last one was, I think, in 2012, 2013, thereabout. And the cholera cases in that country as well also rose because of the flooding crisis that happened. And that's also one of the ways you can tell the climate and health story. We can move to the next slide, please. So now this is where we come in. Where do we get this climate and health stories? I've shared some of the examples, which I may repeat when I make this presentation, but the number one sources are the experts next door. And we are lucky to have Dr. Tolu here, who I believe will share her contact. She's a public health specialist, so you can reach out to her and find out what are some of the issues in Nigeria. She mentioned Egypt, so that you can tell the story and have an expert at being part of it. You can speak to climate scientists, because right now there's a lot of conversations between climate and health. And as Vivian mentioned when we were starting the webinar about the Malawi African Regional Climate and Health Conference, which was the first one to be held in a long time. It was organized by AMREF. So if you reach out to AMREF, then you'll be able to get experts to speak about that linkage between climate and health. And of course, the World Health Organization this year specifically has been talking about the link, why we need to link health to the climate change issue. I mentioned earlier the Kenya Medical Research Institute for Kenyans. I believe the other countries can speak about their research institutes and the studies or the researches that they are doing. Reports, because one of the stories that I did on malaria moving to the highland regions, because in Kenya, most of the malaria cases are in the lake region. But lately, there's a report that was done by the Kenya Medical Research Institute, which showed that the malaria parasites are moving towards the highland regions that were never there before. If you live in Nairobi, for instance, the malaria the mosquito in Nairobi does not cause malaria, but I was speaking to some experts who say that some new mosquito types have come to Nairobi, and we could have patients with malaria who are originally from Nairobi and not imported cases, maybe people who have come from Western Kenya and are in Nairobi and have malaria. Scientific studies, of course, the Lancet last year released a study still related to vector-borne diseases moving to places that were not there, and it's because of climate change. And then existing policies like the nationally determined contributions, which we are all mandated to be part of because of the Paris Agreement, and our national adaptation plans. And if I can just speak about the national adaptation plans in Kenya, for instance, I feel like there's a story there because they have the plan set out, they have the action points, they even have a budget, but the implementation is where the problem comes in. So as journalists, we can write stories about those gaps, the implementations. We can ask our government officials, why are they not implementing the national adaptation plans, the NDCs on health? If there's no health in your NDCs, can you maybe speak to your environment and health ministers to include that in the next update of the NDCs? And then you can also follow key specialists online on climate and health. And an example that I'd like to share with you is Mr. Arthur Wines, who is, maybe if some of you don't know, he is the COP28 advisor on health. So you can reach out to him via LinkedIn and he'll be able to share more insights. He also posts a lot of stuff on LinkedIn on climate and health. And other ways you can do such stories is to localize the stories from other publications, international publications. If you see maybe Vivian from Nigeria has written a story that sort of relates to the Kenyan population or the Ugandan population or the South African, you can localize it by interviewing or going to the ground and speaking to experts. Next slide. These are some of the resources that I shared. The WHO have talked about it. The Climate and Health Alliance, which has released actually a new study today on how methane is influencing health. You can follow them. Another tip I'd say is you reach out to their communications people to add you to their mailing list so that you can get updates. So Climate and Health Alliance is a good resource for you. AMREF, I've already talked about it. It's an African, so it fits everyone who is on this call. And then the Wellcome Trust, which is also part of KEMRI, and the global aspect of it is that it has different data sets for people in different parts of the world. The Lancet, which is a scientific it's a
Sorry,
scientific
can we all
journal,
mute
and it
ourselves?
has. yesterday, so there's no link in my presentation there. So the Pandemic Action Network is a network of people from different fields, but they talk about the nexus between climate and health. It has been there for a long time, but if you talk about most of the zoonotic, like COVID and every other zoonotic diseases, climate change, we know, is influencing or making it worse for climate on health issues. So if you reach out to people from the Pandemic Action Network, I have some of their contacts. If you need, I can share with you. Next slide.
Okay.
I think this is the last slide. Vivian, can you hear me?
Yes, I can. Helen?
Yes, I think that was the last slide. Yes, that was the last
Yeah.
slide. Sorry about the internet issues that I've had. I hope my presentation has been helpful, and I'll welcome any questions.
All right. Thank you so much, Helen. Thank you so much. Those were very good resources. And I hope that when you share your presentation with us, I'll be able to share it with the community, and then they can, take some of those resources and use them in their subsequent reporting. So let's show Helen some love. I'm already seeing like a lot of like low-hanging fruits and stories that we can even do from these presentations. When Dr. Tolu was making her presentation, she talked about how people go out to exercise and get fit, but in the process of exercise and getting fit, they are in these public spaces, and these public spaces are even polluted. So sometimes you go out to exercise and try to get fit while you're taking in an air that would even cause more health problems for you. So these are like stories you can begin to look into, to like maybe do like a survey of like 2 or 3 people who are into gym, fit, and all of those things, and find out where exactly do they exercise, what kind of places do they go to for exercise. And we can reach out to Dr. Tolu for maybe like in places like Lagos, we can look out for what's the measurement, what's the data in the air pollution in air pollution data in Lagos, and how it's impacting the health of people who think that they are going out to get fit but are killing themselves in the process. So these are like low-hanging fruits. And when Helen talked about air pollution, and it made me think back about Dr. Tolu's presentation, where she talked about the fact that children below the ages of 5 were the ones who were dying the most from air pollution. And then it reminded me of a Guardian reports that also talked about the fact that some women went to protest because the air pollution in their cities were killing the children in their bellies, pregnant women actually. So these are like stories we can already start thinking about, that we can do to talk about what's happening on our continent. So I'm trying to read out some of the questions in the chat. Ruth Aura said, the other day I attended a scientific conference and learned that we now have numbers of NCDI rising due to climate change. In Kenya, we have diseases like, okay, I think I'm missing something. This was from Helen's presentation. Okay. So Vitality Health said, what affordable tools are there to measure the quality of air? I think this would go to Dr. Tolu. Dr. Tolu, are you there?
Okay. Yes, I am. It's interesting. There's a lot more now. So there's a lot of a rise in production of low-cost sensors and also wearable sensors that are increasingly reliable. So that technology has improved significantly. Helen mentioned AirQuo as a good example of an organization, based in Kampala, and there's several others that are developing low-cost sensors that are tailored to our context, or high dust context, to high heat, etc. And then similarly with wearables that you can carry along with you. These are there's a rise in those. So one of the things that we're doing actually in Citizens, I just put in the chat there in Lagos and Accra, is taking a shared model, because not necessarily everyone needs to have one, but in democratizing access to this kind of data, what if you had a hub where you could go and borrow sensors to use for, walk around with and do whatever, capture your information, like Helen did around the the protest. What if you could go tell a story? You go borrow a center and actually create a resource locally. So that's one of the things that we are, the Urban Better Citizen is actually growing on the continent to look at how we can create this infrastructure that is shared. So yeah, I hope that answers. And that's air quality. By the way, heat is another. We didn't actually talk about heat a lot, but I just want to also maybe disavow us of the idea that, oh, Africa is hot, so heat isn't an issue, because we're seeing this, and some of it is because we're not measuring, right? So with extreme heat events happening, there's a link between extreme heat and rise in high blood pressure, strokes, and heart attacks. We see that in India, in Pakistan, so these are hot countries where you have extreme heat events and people die. But it's something that we're not measuring. So if you don't measure, you don't know. You don't make that connection like, oh, there's an increase in admissions on this day because this is happening. Could that be because this is happening? So this is, again, another reason why these measurements is so critical.
Yes, data is actually very important. So Dr. Tolu, Franklin also asked, he said, what can we learn from the COVID-19 lockdown, especially in urban centers where air quality greatly improved during the lockdown?
Oh my gosh, we've actually, I'll share when I stop talking, I'll share a paper that we wrote on this with some colleagues in about Lagos. And it's a couple of things. Is one, we know that there's an unmet demand for healthy climate resilient public space, right? It looks as if, people don't want to use the space. It's like, no, when you make the space that is and actually is supportive, people use it. Secondly, we know that it's possible to create those spaces, right? It was unfortunate that obviously the COVID-19 pandemic is not something we ever want to have reproduced. But in the face of that emergency, we were able to make that happen. Now, we sensed the emergency because it was right there. But we have this climate emergency that we're not sensing because it's so much more slow motion. And so there is there's this feeling of like, oh, all these things we can't do. You know what? When we had to, we did. So I'm going to share a couple of links to a couple of things I wrote during the pandemic there. But let me tell you, during that just a couple of months, April 2020, I had this student from India send me an email. Like I'd met him at some youth science forum that I'd spoken at, and he sent me this message to say, and he was a first year at university at this point. He was in high school when I met him, and he said, he lives in Delhi, and this was the first time he'd ever seen the Himalayas, the mountains. He didn't even realize he could see it. And then he was saying, well, what if we could? It sounds crazy, but and maybe naive. But what if we just stopped once a month or once every other month and just to improve the? I'm like, you know what? It's not crazy. It's not naive. We need wild ideas. Business as usual isn't working, right? So we need wild ideas to say, okay, how can we do things differently? Because we actually know it's possible. So when we talk about things like open street days, car-free days, it sounds disruptive. Oh, in a big city, you can't do that. You know what? We can, because we actually stopped when we felt like we had to. So this is the power of narrative to show that this is an emergency. Yes, it's not the same as an infectious disease emergency where you see people die, but it is an emergency, and we need to take emergency measures like we do during emergencies.
Yeah, so more like we were forced to do the needful when the situation called for it, and of course the climate change is an emergency, and we have to also like address it the same way we did the pandemic. So Pembere said, thank you, Dr. Tolu, for the presentation. Just wanted to find out about the extent of the impact of cement production and air pollution in Africa.
Sorry, I'm multitasking badly. I'm just going to share one thing with you first, one link, and then I will. Cement is one of the significant contributors to greenhouse gases globally. Right, the global cement industry, in terms of CO2 emissions, in terms of NOx, in terms of sulfur dioxide. So It is vast, right? One of the things that we haven't talked about is the competing priorities and the importance of addressing those, right? So we talk about it. It often comes up when we talk about planning and health, like, oh, people need houses. Oh, but how do we maintain biodiversity and not clear up? So there's this tension, like, okay, we need to build, but cement industry is polluting very actively and is one of the biggest industry sources of emissions. But I don't think we should shy away from that because this is a complex issue. So questions are we innovating? Are we pushing and innovating enough to look at what alternatives they are? Whether they, I mean, I'm not aware, I'm not a cement expert, I'm afraid, but are there any ways of, what are the main sources of the of emissions in the manufacturing process? What are the innovations in how we can think about cleaning and improving the emissions? Because we've seen it with other materials, other energy sources, right? But we have to be working at it, right? So if the industry isn't, then we're just going to sit with this tension of like, oh, but we're trying to provide houses or we're not. It's like, yeah, but we have to actually start thinking about alternatives and actually being at the forefront of that. Because it's not just emissions, it's also how it contributes to heat and urban heat islands. So how can we mitigate, how can we adapt? What is the role of green infrastructure to reduce that? And in the interim, because again, it's not like there's nothing we can do whilst all of this is happening. So it's complex, you know, but it's important, I think, to confront that complexity and confront those conflicts in order to think of a way forward. But burying our heads under the sand is not an option. Huh?
Yeah, I hope that was helpful for you, Franklin. Okay, so Vitality Health said, Dr. Tolu, can you kindly provide some insight into the relationship between drought and health?
Drought and health. Okay, sorry, hold on. You're catching me as I'm sending the two the two links that I said I'll send. Okay, that's the second one. Drought and health. So drought impacts the food production, right? So you have issues around food production, increasing risks of food insecurity, risk of food insecurity, increased risk of malnutrition, right? Drought and health in terms of access to reliable sources of water and sanitation. You don't have that, increasing risk of diseases, increasing risk of ill health. Drought and health in terms of mental health. I think someone asked about mental health earlier. Farmers and agricultural workers, failure of crop is an important source of poor mental health. I don't know in the African continent, but I know in the UK and perhaps in Europe, the agricultural workers, that sector has one of the highest rates of death by suicide, and part of it is the forces beyond your control that mean that you have crop failures that could have significant impact on your livelihood. So these are some of the ways that something like drought can impact health directly and indirectly.
All right. Thank you so much, Dr. Tolu. Yeah, so I know you mentioned that earlier, probably the person wasn't here because you brought all of the interconnectedness of how health is different from healthcare, you know, and how food systems, you know, mobility of people and all of that, you know, impacts our health as human beings. So thank you so much. So this question goes to Helen. Most of the editors in newsrooms are former political reporters and have little to do with climate change and environment. How would you advise environmental and climate change reporters, especially the youth who think for you to be big, you should follow in the footsteps of your especially for youth who think for you to be big, that's for you to do well, you should follow in the footsteps of your editors. Helen.
Thank you, Franklin, for that question. And maybe this is just my opinion. I don't think that for you to be big, you need to follow the footsteps of your editor. You can chart your own path. And to answer your question, how you can push for environment and climate change stories. This is something that most people, especially in the African continent, are struggling with. If you say open our newspaper today when there's a big climate issue, let's say the COP, you'd find that instead of our editors using stories that have been published or written by a local African reporter, they'll use a story that has been published by the wires like the Associated Press. So to move away from that, I'd advise that you localize the stories. And by localizing the stories is you do that by speaking to people, because like I said earlier, people relate to what people have, the people experiences. So if you humanize your story well enough, you can get your editor's ear in that regard. And if they still find it uninteresting, you can politicize it, because environment and climate change have politics in it in a way. So the example that I gave earlier of how air quality was affected by the government protests, everyone would want to read that because of that political aspect. So if you can politicize it in a way, it will entice your editor whose background is in political reporting. But the more you keep pestering them with climate and environment stories, the more they'll get enticed with it in a way. But to do that, you have to do it in an enterprise way. Don't just do it in form of a report, but have people included in that report.
All right, thank you so much, Helen. So we have Norbert, Sunday, and Winnie. Your hands are up. So I'm going to just allow you unmute your mic, but please make it brief because we're already out of time. Sunday, please.
Okay, good morning. My name is Sunday Long, a journalist. I work with Sahara Reporters. Thank you for the opportunity, and thank you, Helen and Tolula, for the presentation. I'm not really into climate reporting, but it has always been my interest. And my challenge starts from the basic. Many people I don't know if I'm right, I think it is my opinion, many people don't really understand the thing of climate change we are talking about. And gas emission, automobile gas, is it gas emission, is one of the things that have been attributed to major cause of climate change. And this happens both in rural, semi-urban and urban societies. How do we get my problem now is if I want to do a report on that aspect and me getting primary the data from local area, within the towns and all that, from trying to speak to public drivers, people that engage on daily basis of automobiles, the activities like drivers and all that, trying to get them to understand maybe what they do. Like sometimes I move on the road, I see cars that go and then you see exhaust blinding other drivers and all that. How do I get a story out of that kind of a thing now, getting it to a report that will make a change? It's a kind of challenge to me. It may sound somehow to people who understand it, but to me, that's trying to be a new entrant into it. If you can throw light on that.
Okay, Dr. Tolu, do you want to go?
Yes, I think I will borrow what Helen said around telling the human story, right? And I think you're absolutely right there, Sunday, in saying, well, often climate change for a lot of people is just this abstract thing that is just, okay, it's happening in the future, but what about now? And that is the power of centering health in climate when you talk about climate action, because health is happening now to you, right? So bringing that together with what Helen mentioned around centering it around people and people's experience, you can say, oh yes, okay, there's this happening and the cars, but okay, what's that got to do? I've still got a place to go. But do you know how that is impacting your health? If you were a if you're a traffic warden and you're standing in pollution and that much, do you know what how it's impacting your health? If you are cooking on the side of the street and you know, sitting with fumes with your baby on your back, do you know how that is influencing the development of the lungs of your baby? By drawing these stories together, connecting to health, this is what people feel. And there's a really nice exemplar for this in if you look at Ekwo's experience in Uganda, for example, where they worked with people who work in public space, so market women and people like that, and they were hosts. These community people hosted these centers, and then when they could see, and they've got a video on YouTube around this, if you kind of look on their website and their YouTube, there's this market woman saying, I didn't realize that I'm here with my children all the time. I didn't realize this was the air I was breathing. Yes, it impacts climate change, but it is when my child keep taking my child to the hospital for pneumonia and the asthma is getting worse. I didn't realize that this was connected to this. So now my thinking, my understanding of climate and importance of climate action is not just this abstract thing, but it's also connected to my day-to-day existence and my health and well-being. So these are the kinds of ways that so looking for people who are capturing that information, looking for people who have those exposures, and this is what we're trying to do with Urban Better. So really finding those sorts of information and making those connections, like Helen did in kind of the protest. These are the ways to start to get people's attention, starting with where they are. You must always start with where people are. It's not trying to convince people. I believe human beings are rational. I don't need to convince you climate change is important, right? Let me start with where you are. What matters to you? And let me draw that connection between what matters to you and this bigger picture and why this is important in order for you to see and be part of pushing this, the importance of action, urgent action.
Wow, absolutely. Thank you so much, Dr. Tolu. You know, it kind of draws my mind back to a story I did. I just stumbled on the story in Benue at the time. And then there was this woman cooking with firewood, and then her babies were all around the fire inhaling, and and then I asked her, doesn't it affect them? She says, oh, they complain about their eyes, they complain when they are sleeping, so it's affecting their health. And at the end of the day, she ends up spending more on hospital and healthcare than trying to get her business. So those are the Elom, like Dr. Tolu said, humanize the stories, look for people who are being impacted, and then interview them and tell your story. Thank you so much, Dr. Tolu.
And maybe just to add to that, and be that advocate for that person, because again, even if she then knows that, if she doesn't have any options, she's not going to stop earning a living, right? So the power of the narrative to say, okay, there are other options in terms of cleaner sources of cooking, what is the role of government? What is the role of private sector? Whose role is it to make sure to support that healthy transition, that healthy behavior? So I would also encourage you to, yes, tell that story, but go beyond this. Okay, now I've told her. It's like, but the next day she's going to do the same thing if she has no choice. What's she going to do? Stop earning money? So how do we actually support people connect to options and other kind of cleaner options that are better for the environment and better for health?
All right, thank you so much. I hope that's helpful, Sunday. I think Norbert has lowered his hand. Probably his question was answered.
Yeah, thank you so much.
Okay, I'm going to move over to Winnie. Winnie, please.
My name is Winnie, and my question is, I'm a journalist in Ghana. I'm trying to do a report on how air pollution threatens food security in Ghana and everywhere. I want you to help me understand or enlighten me in some examples or some ways that air pollution really threatens our food security, especially in Ghana, where our government have this initiative of planting for food and jobs. So if is air pollution going to be a deterrent to such initiatives? I just want to know how scary this is.
Winnie, in the interest of time, I will just actually share with you. I'm just going to find it. Somebody working in Ghana on this very topic.
Okay.
Yeah. So then, because he will then be the expert, he's been monitoring and looking at agricultural food production and air quality focused in Ghana. So let me just, in the interest of time, give space to someone else, and I will just share the link
Sure.
with you in the chat.
Okay, I don't think we have. Here. Okay, Nabat says, Dr. Tolu, while you share with Winnie, I don't know if I can go ahead with Nabat's question. Okay. So Nabat says, here in Uganda, we are having a challenge with government officials and other people connected to the state taking on massive industrialization in sensitive areas like wetlands and cities. Journalists have been intimidated when they try doing or even do such stories affecting the climate. Are you guys facing such challenges, and how have you gone about it? Maybe I'd
Uh,
there.
well, no, but that's a really interesting question. Our approach is generally been one of collaboration, right? I really do take the asset-based approach to everything I do, to say, even in the most difficult settings, I can always find one person who is like-minded, who maybe even in the organization they're working in, they've been struggling to do this, be that government or private, and they're looking and they're speaking to them like, okay, help me, help me make the case here, right? And I think that approach does help to mitigate somewhat. So start with, well, what have people been trying to do in-house that maybe they've been struggling with, and what is my role as a physician, as a public health physician, and as a scientist, to say, what is the role of my expertise and evidence to help support action. I do feel for journalists, and I know that this has been something that is being played out the world over, right? Not just in Uganda, and certainly not just in Africa. I don't have a solution, as it were, but I can say that I always find people. There's always somebody. There's always one person, right? It's very easy for us to say, oh, the government are this, or the transport people are this, but if you dig deep, there's honestly, I've never been in a city where there isn't one person who is just working away and trying and trying to make a difference, but the environment is not supportive, and to work with that person. And sometimes it means that it's not my story to tell, and I'm just behind the scenes, like, how can I support you to be more effective in what you're doing? And that I use that to tailor what I do, because that might then identify what the lower hanging fruit are, to say, okay, I could go in as this kind of bull in a china shop, or I can I can go in and say, okay, actually there's a low hanging fruit here. If we have a bit of this, we can kind of claw at it. Now, I actually think all different approaches are necessary. It's not one or the other. It's just sometimes different approaches for different situations, and different contexts. So I think that nuance is how I deal with it. But other people have different experiences, and I do think we need all sorts of different types of people. We do need to break things. We do need to also work from the inside as well.
Wow. All right. Thank you so much, Dr. Tolu. Thank you so much, Helen Shikanda. And thank you, everybody, for being here. This is where we draw the curtains. We don't have any more questions, and everyone whose hands were raised. Uchenna, sadly, we can take any more questions because we are out of time. We've overshot. So I'm going to say that we are going to share this presentation with everybody, and then the contacts of Dr. Tolu and Helen in case you want collaborations or interviews with Dr. Tolu or Helen in Kenya. You can always reach out to them. So this is going to be our monthly safe space as Africans and journalists in Africa who are interested in climate change and who are already reporting climate change. So always come and discuss. We're going to do polls to find out what topics of interest, what areas we're interested in, to bring experts who can speak to us on such topics. And I'm going to make sure that I send out the links for the communities that we have on WhatsApp, Facebook, and Telegram, so you can join us and get updated when such events are happening, because we're going to be launching our newsletter soon, and yes, it will hit your inbox, and I hope that you engage with us. So thank you so much again, and I hope to see you next month when we have another community hangout. Thank you so much, Dr. Tolu. Thank you everyone for coming.
Thank you, Vivian, and good to see you all.
Thank you.
All right, bye.